Okay, so we're going to look quickly at this slide. We're not going to go into depth. These are embryonic stem cells, and I'm going to go back. We're sort of go back and forth. So we're going to look at the embryonic stem cells. So we start with the egg and the sperm come together, and they're sort of one egg, but then they divide to 2, into 4, into 8. So we keep going and going till we get this next structure called the blastocyst. And we end up with this layer of cells like a hollow ball, and then this inner mass of cells. And what we do is we take that inner group of cells, and we can grow that on a dish, and we can then make them become anything, all right, along the bottom here. And that's not so easy to do, but we make it look easy. So embryonic stem cells are nice because they have a high capacity for proliferation. So they're actively dividing already. So we put them in a dish, they're going to keep dividing. This is great. We can get a lot. They have those very long telomeres, which means they're very young. This is good. They have this pluripotent ability. They can become lots and lots and lots of different cells, as you can see along the bottom here. And there's low risk for disease, right? So presumably this embryo has not got any disease that can be passed on to its recipient. The negatives are that they originate from abortions or from in vitro fertilization, which is the main reason for contention about all of this. The cells could change in an unfavorable fashion, and this is something we're trying to control. They can also generate tumors like those teratomas we showed you. Oops. And of course, well, this is the same as the first, is the public acceptance is questionable. So not everybody's going to say, yeah, great, give me an embryonic stem cell treatment. Okay. So the umbilical cord blood, I already talked about a little bit. This is good availability. We can get that from any child being born. Minimal risk to donor. It doesn't hurt to remove this from the umbilical cord. Again, they have a high capacity for proliferation, so these cells are still very young. They're going to divide. They again have long telomeres. They don't have very long telomeres, but they have long telomeres. Minimal risk for infectious disease, so unless the mother has HIV or some other disease, there's probably not much chance that the cord blood has that. Again, pluripotent abilities, and it is acceptable to the public. Negatives is the number of cells are limited by the volume collected, so any one person can only give so much. And then we need to be stored in a cord blood bank, and that costs money. Embryonic stem cells cost money too, but this is out of your pocket usually. Okay, so here we have adult stem cells, and if you notice, most of these images are coming from the NIH, so the National Institutes of Health have a website about stem cells, so you can visit that anytime and learn a lot more than what I can even tell you in one day. So here they're showing the adult stem cells coming primarily from bone marrow, and this is our most well understood place for obtaining stem cells. So our adult stem cells have multipotent abilities, which is less than pluripotent, so it can't become any type of cell, but it can become a lot of different types of cells. Moderate availability, so the older you are, the harder it is for us to just reach in and grab some stem cells. So it is acceptable to the public, adult stem cells, because you're a consenting person, says, sure, you can have my cells. But their capacity for proliferation is very low, so they are not going to just fall in the dish and divide and divide and divide. They do have short telomeres, so they won't last as long. And there is a risk of infection for the recipient because you don't know exactly who you're getting all of this from. And then, of course, risk for donor during isolation. If you aim for bone marrow, they have to, aim for the iliac crest here. It's a very painful procedure. Okay, so now we're going to talk about adult stem cells that we have in us every day that are being just used all the time. So adult stem cells, proliferate and differentiate. So it's two big words. So proliferate means they divide. So a stem cell always has to be able to divide. So if a cell is not dividing, it's already out of the definition of a stem cell. They also need to be able to change or differentiate. So they can stay the same or they can differentiate. So what usually happens is we create another stem cell. So in that mitosis, it divides into two. One will be a stem cell, and one's going to change to help that part of the body. So if this is in the stomach, it's going to be a cell that's going to help the stomach, all right? So we usually use stem cells every day. You have stem cells working all the time. Where cell turnover is very high, and that's your skin. You know your skin's falling off. Well, we always have new skin coming up. The digestive tract, as you know, it's very harsh in the stomach and the small intestine, so we replace our cells every 3 to 5 days. And then our red blood cells really only last about 120 days. So we always need to be making new red blood cells all the time. So the bone marrow is where we're making new blood. This is a side note, but if you ever want, people who go through a chemotherapy, they lose their hair. They have digestive problems. They will end up with anemia. And that's because chemotherapy will target cancer cells which are dividing rapidly, but so are our stem cells. So anywhere we rely on stem cells is where you're going to feel the side effects. So like anemia, and this is bone marrow cells right there. Hair loss, which is from the skin, obviously. And digestive troubles, this is from actually the colon. So this is because of stem cells dividing rapidly as well as cancer cells. So we keep stem cells in reserve. They aren't always working, but we're finding more and more that we have lots of stem cells in our body. So we have these, here's a big word, hematopoietic stem cell. These are the blood-forming cells. So that shortcut HSC appears a lot in the newspaper. Connective tissue stem cells. So they find that actually if they can take some of your fat from you, they can direct that fat to change and not be fat anymore. And they can then tell it to be cartilage. And maybe we can replace some cartilage if you have some worn cartilage in your knee or something like that. Some epithelial cells. So your skin is epithelial on the top, your vision, your hearing, your taste, your smell. All of these are controlled by epithelial cells. So we're finding some of those type of stem cells. Cells that can help regenerate the brain and the spinal cord, so neuronal, and cells that can help regenerate muscle. And we're mostly interested in heart disease because that's a type of muscle that gets damaged quite greatly when you have a heart attack. So we are also finding stem cells all over the place and in non-invasive ways. So this would be good if we can get stem cells from menstrual blood. And this has been for a couple years. They've been able to obtain stem cells from there. They can obtain stem cells from the placenta or amniotic fluid. So that's useful and non-invasive. Breast milk as well. They're finding stem cells. In fact, this picture shows the green cells are adult cells from the breast in breast milk, and then all of these blue and orange cells, I guess they're Illini fans, those are stem cells from breast milk. And those can be isolated, and then those will proliferate, and then we can differentiate them, and we can use them for things. So that's very useful. Baby teeth are also a source of stem cells. So if you lose your teeth, and then you take that tooth pretty quickly over to a special bank, they can rinse stem cells out of it and save that for you. So hair follicles, so we can pluck our hair, and we can isolate stem cells from hair follicles. From those cells, we can create new skin and also new hair. So they're sort of hoping for some hair loss remedies. Sounds pretty complicated, but it might be worthwhile. Skin, of course, is really important if you have a burn. It'd be nice if we could have little pieces of skin that we can ship off to hospitals. Saliva, they're thinking, maybe in your spit there might be stem cells, but I put a question mark because everything I read, they were actually taking from the salivary gland, which is very difficult. So these get more invasive cells lining blood vessels, so if they got a hold of some of your blood vessels, they can get some stem cells from there. Also from the testes, which sounds painful as well. So what next? Maybe from toe jam.